Yeah. Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we have Kamalesh, native from Vijayawada, Andhra Pradesh, India. Yes, Kamalesh, you can start now.
Hello, I'm Dr. Kamalesh. Can I know your name? Please.
My name is Margaret Thatcher and you can call me Maggie.
Okay, nice to meet you, Maggie. Can I ask what is the name of the girl, please?
Her name is Dorothy.
Okay, nice to meet you, Dorothy. Yeah, uh, Mr. Margaret, I'm very sorry to say this, but I want to convey the message that your child is suffering with a condition called chickenpox. So, do you know anything about chickenpox?
Yeah, I know only one thing, that I am the mother of this girl and I am worried about her health. I don't know anything. I want to know the details. What exactly is this? And I want to know everything about this. I want
Okay,
to know
sure.
whether it is dangerous or if it is contagious. What exactly is this, please?
Okay, so from the history and the examination of your child, what we have arrived is that she is suffering with chickenpox. So this is caused with a virus, some neurogenic virus. That is, it affects nerves mainly. It is called Varicella zoster virus. So this virus usually it's a self-limiting disease. You don't need to worry much. So the condition or how your child is reacting depends on her immunity, not on the drugs we use or anything like that. But I want you to understand that this is a self-limiting condition, and usually it lasts around something around like 2 to 3 weeks. It starts just like your child with a fever and rash. After that, you might see some eruptions of the body, like fluid-filled vesicles, which will cause some fluid will be there, and it might get ruptured over days or the next week. Then what happens is she might feel little itchy or too much itchy over the entire body. So that is the phase where it gets transmitted to other person. So I want to advise you that you should take care of the child, isolate the child, or quarantine the child, avoid her sending to school. So that so this condition, the condition does not have any medication. So it is just some supportive treatment, like I will prescribe some vitamins and what to do when the child feels any itch or her body, what to do, something like that. I will prescribe you some medicines for that. Is that, are you understanding? Are you following me?
Yeah, of course, I'm able to understand. And I
Okay.
want to tell you one thing. I have a 10-month-old son. Will he
Okay.
catch it? Is it dangerous for a young child?
I'm so sorry to tell you this, but it is really contagious. It might spread to your child, your other child, because when the fluid gets out of the vesicle, what we call that in our language, it spreads when there are some things called fomites. When when your child or your your elder child gets in contact with the same substance like towels or napkins or the food bubbles, whatever they are using, it might get transmitted. So I want to make sure that the child should be isolated, and you make sure that everything is in line, and whatever she is using, kindly decontaminate it. Use something like a good disinfectant, something like Dettol, disinfect the clothes, and then reuse it again. Or else, I advise you that you don't get in contact with them. So, is there anything else you want to know?
Yeah, of course. I want to know when my child can return to school, because she is going, she's going to school regularly and she doesn't want to miss. So she will ask me as early as possible. So when is it possible that she can return to school?
I think the spots until the spots should will turn to black. That is the scab formation. The fluids will erupt and then they turn to a scab, like a dark patch, small patches you can see over the body. At that phase, she is safe to return to school. Until then, she should be isolated, and because to prevent the contamination or to prevent the contagiousness of the virus, we need to do that. We need to make sure that the child is isolated uh, within the house. That's what is best for her. And also to help you with the itching, I will prescribe you something like you can you can use some cotton clothing, which is very comfortable. It should be it should be loose enough so that it will not trigger the itch. And lactocalamine or calamine lotion and some drugs called antihistaminics like Benadryl. I will prescribe that. In addition, I will give you paracetamol and some vitamins which you can take over the counter, which will help the child with fever. And that's it. Is there anything else you want me to tell?
Yeah, I want to know how I can stop the child scratching the spots.
There is nothing much we can do, but one best thing what everyone does is we need to educate the child, and you can use something, this cotton clothes, which I have already explained to you. Cotton clothing, loose cotton clothes. Don't put on some jeans clothing or tight pants for her, which will trigger the itch. It will increase the amount of time she spends scratching her skin. So on and off, I advise you morning and in the evening, apply calamine lotion. So it will soothe, it will make the skin tangible. It will be very soft and it will be cold enough so that it limits the scratch. In addition, I would like you to give 5 ml of this Benadryl syrup once in the morning and in the evening, and it will help to reduce the. It's an antihistaminic, like it is for the itching. The drug is for itching. So these measures, if you follow thoroughly, am sure that she'll come out uh, and she'll be in good. She'll be coming out nice.
That's very nice, doctor. Thank you very much for your kindness, and I really appreciate your patience in explaining everything. Thank you once again.
Thank you. I want to mention one thing here. This is a neurogenic virus. So, if your child is feeling some numbness or the area or the fever is too high, let's say more than 100, you should bring the child to the hospital
That's fine, doctor.
because she needs admission and she needs to get looked after in the hospital, not at home. Do you
Okay.
understand that?
Yeah, of course. Thank you. Thank
Yeah,
you very
yeah.
much.
Thank you.
Right. Um. Yeah, Dr. Kamalesh. First thing, you remember I told my name is Maggie, Mrs. Margaret,
Margaret.
and you said started with Mr. Margaret. Maybe by
Oh,
mistake you have
yeah.
told, but you said Mr.
Yeah.
Margaret. So I am the mother, and this is the daughter. Okay, fine.
Okay.
Huh?
Okay.
Next, you can call me Maggie also. I told you. You could have called that also, no problem. Okay, fine. Now, knowledge regarding the subject is excellent, or you can say outstanding. Flow of thought was fine, better than the previous one, and you are doing well. And accuracy is well maintained. You have not that much problem with your grammar. You have problems, but not that much problem, which is going to seriously affect you. And then fluency is, I cannot say better, but it's okay. It's good. You have come up. And then grammar is sound. Then vocabulary only is little bit average. And then pronunciation is fine now, doing a little better. And now I'm going to give you some other suggestions. So avoid active voice as far as possible. Now, what is this active voice? What is this passive voice? I need not tell you because you have learned them already. Active voice means that the doer is important. The doer is important. Passive voice means the recipient is important. For example, I teach English. I teach English. So I am doing. So I teach English. I is important here. So the person who is teaching is important. That's why I teach English, because I came first. So first priority to the person who is doing. I teach English. I is the person who is doing. So I teach English. The person who is doing has become the subject of the sentence. Now coming to the point, English is taught by me. So what is being taught is important. English is taught by me. By me is least important. That's why English is more important. So it came forward. Now, I teach you. I teach you. I am the doer. You are the receiver. So you are taught by me. So you is important. So you came forward. So why don't you give the importance to the receiver rather than the doer? Because doer is not important. If I don't teach, somebody else can teach. So try to understand what is being taught and who is being taught is important. What is being taught is important. Who is being taught is more important. Okay. Who is teaching is not important. You want your son to learn English. Who is teaching is not important. Your son is learning English. That is important. English is important, and your son is important for you. If the teacher is an excellent teacher, he's a professor of English, but if your son is not able to learn from him, then you will fire him and appoint somebody else. So try to understand that point. English is important and your son is important. The professor is not important. An ordinary person who is teaching English, and when your son is able to understand, you will appoint him because he is able to make your son understand. That English is important, your son is important, not the person who is giving education. The English is important, the subject is important, and your son is important. So the receiver is important. Now let us see. I gave you a pen. A pen is direct contact with me, but you are indirect contact with me through this pen. This is you and this is I. I is the right hand, you is the left hand. I gave a pen to you. So I have a pen, gave a pen to you. Now the pen is in your hand. Now who gave a pen is not important. The pen was given to you. A pen was given to you. Because who gave is not important. Who gave is not important. For example, your boss calls you and asks you, Has the patient been treated? He will not ask you, did you treat the patient? Did you treat the patient? Is not fine. You are not important. Has the patient been treated or not? That is important. You treat the patient, or your friend treats the patient, or your colleague treats your patient, or your junior treats the patient, or your senior treats the patient. That is not a problem. Has the patient been treated or not? The ultimate end product, the result is more important, not who treated him. I hope you understand now. That is the speciality of passive voice. So try to use this passive voice. Try to use this passive voice. Then your sentence becomes goal oriented. Otherwise, it is as if you are boasting. I will recommend treatment to you. I will recommend treatment to you. I will recommend Ventolin. I suggest you to use Ventolin. Who are you? You are just one doctor. There are millions of doctors in this world. If this patient goes to any doctor, he can recommend. No. So what is your specialty? Who are you? You're just one doctor. Why are you saying, I will recommend? If not you, Tom, Dick, and Harry. Any doctor can recommend. So what is your greatness in that? Why are you boasting? I will recommend Ventolin. So that is to be avoided, because patient is a priority here. Make patient more important, because I don't know whether you understand this one. So I'll take you to mother now. Earlier I took you to father. Now I'm taking you to mother. Now, mother is official OET. Just type official OET website. Official OET website. And then you can say active voice or passive voice in speaking. Just type like that one in your browser. So just type in that one. Go to official. Do you know how to write passive voice perfectly, correctly? Do you know how to cook biryani? That means I want you to cook biryani, na? Do you understand, Mr. Kamalesh?
Kamalesh.
Do you understand what I?
Yes. So we need to be
Do
patient
you know
centered.
how to write passive forms correctly? That means you have to write passive forms, and you have to write passive forms correctly. Yes or no?
Yes.
Do you know how to write passive forms correctly? Means there are three questions in this. First one is, do you know how to write passive forms? Number one. Do you know how to write them correctly? Do you know that they are important in OET? Three questions are there. You understand now?
Yes.
So question mark. Do you know how to cook biryani? That means I want you to cook biryani. Is that clear or not? So that's it. Now, yeah. Passive forms are great for making the patient or treatment the focus of a sentence. Until I explain you, you will never know this. Until you read this, you will never know. Using it during writing and speaking subtext can help your language be more sympathetic. You are not sympathetic. You are boasting about yourself that you are a great doctor. But you are not talking that giving importance to the patient. Okay. You're thinking that you are giving importance, but in actual situation, you're not giving. You're talking about yourself more. I understand your concern. I do this one. I do that one. I treat this one. This is better for you. That is this one. Okay. So that all those things, they just blah, blah, blah. Patient is not 100%. As a nurse or a doctor, as a doctor, instead of nurse, you can say, as a doctor, you can use your language to build better relationships with patients. Just remove this nurse and put a doctor here. As doctor, you can use your language to build better relationships with patients. So instead of pitting the performer of the action that you are doing something great, the passive voice makes the person, that means the patient or the thing being acted on, the subject of the sentence. So make it the subject of the sentence. Bring it forward before the verb. Medications are to be taken on a daily basis. Medication compliance is required. Smoking cessation is recommended. Minimizing alcohol consumption would be profoundly beneficial. I recommend you, I suggest you. Where is I? You should stop smoking. Where is you? No, I'm not using I, I'm not using you. I'm using smoking cessation is recommended. Minimizing the quantity of alcohol consumption gradually over a certain period of time, for instance 3 months, is suggested. Where is I? Where is you? Understood, Dr. Kamalesh?
Yes, sir.
So use when to use passives, using correct verb tenses. You have to learn. That's all. Avoid as far as possible. Then next one. um, right, pronunciation fine. Avoid active voice as far as possible. That is what I told you. Now, avoid personal pronouns. I, we. The lesser the personal pronouns, the better your quality. Next one. Talk about the most important things. What is the most important thing? I suggest Ventolin for you. I suggest you that you take Ventolin. Why you? Ventolin puffs twice, Ventolin 2 puffs whenever required or recommended. So where is I? Where is you? There is only I. I am the doctor, you are the patient. Only I am there, only you are there. Why should you tell I am recommending you? He already knows that you are only recommending. Then what you are doing there? Why are you telling my suggestion is to that you take Ventolin? Okay. No need. Don't bring yourself into the picture. You are not important because any doctor can do it. Then why you? Forget that I-ism. Okay. Next one. Avoid talking about yourself and the patient. Avoid talking about yourself and the patient. Patient is all over from the beginning to the end. So don't say you. Don't talk about patient. Then next one, directly talk. In that sentence, what is important? There may be some important subjects in the sentence. I advise you to take good food. I is common. You is common because in the entire speaking, I is I, you is you. We know that I is speaking to you, the patient, I is the doctor. We know. Then why you bring every time? I is common now. I is not special in this sentence. I is everywhere in each and every sentence. I is there because you are only speaking. You is always there because you are only listening. You are the patient for everything. For each and every sentence, you are the patient. Each and every sentence, I am the doctor. That is how you should feel. So I is not special. You is not special. The word you is not special. In this sentence, diet is special. So why don't you bring diet and give it its importance? Give it a crown, no? Regular, nutritious diet on a regular basis is recommended. Finished. Do you understand the importance of what I'm talking? Dr. Kamalesh, you may be a famous doctor, you may be an expert, you may be a professor. That is different. You are the master of your subject. But you know, you're a learner of some other subject, that is English. I'm not talking English as a language. I'm talking English as a subject. So do you understand the importance, Dr. Kamalesh? Yes or no?
Yes, sir.
So are you unhappy because I am talking something serious things and I am
No, no, no.
explaining? You have paid
No,
for
no.
this one. You have paid for this one.
I'm
You
learning.
deserve. You have deserved this quality. Maybe tomorrow you go to the UK. Then you will think, oh, I got Mr. Simon. I am proud of him. He taught me so well that I don't have any problem now. Otherwise, you go to UK and you'll get a job there and you'll speak all rubbish and gibberish and you speak all nonsense things what any other person can do. Then they will say, who taught you English? They will say, first you'll tell my name only, Mr. Simon. Go and ask that fellow to stop teaching English, they will say. The next one, make sure that the child is isolated. Make sure that the child is isolated. Make sure that the child is isolated. Now, the child is isolated. Why the child is isolated? Make sure. Make sure means you make sure. You make sure. Make sure means order. Come here means you come here. Sit there means you sit there. Stand up means you stand up. It is understood. Don't say I did not say you. It is there already in that. Make sure means you make sure. You are telling the patient's father, the caregiver, the mother, to make sure. That means the mother should make sure that the child is isolated. Now, why should you say all these things? She is only responsible. That's why she is standing in front of you as a responsible person, as a caregiver, as a supporter. Yes. She is making sure that she will get everything from you so that she will do it. Okay. Yeah. Ensuring isolation is the utmost priority. Ensuring isolation is of utmost priority. Finished. Isolation is extremely important. Finished. Okay, confidence level is below average. Your confidence level is below average. You are scared of talking. Talk whatever you want, no problem. Even if you talk all wrongs, you talk proudly. This is what I know. Even I do mistakes number of times and I rectify. It's okay. Do mistakes, no problem. The more you do mistakes, the more you have a chance to learn. If you do not do mistakes, why will you come to me? You'll not come. Be confident in whatever you're talking. Whatever you're talking, it's okay. Right. Don't try to be perfect overnight. It's a gradual process. Okay, fine. Is that clear, Dr. Kamlesh?
Yes, sir. Yes.
Okay. Now you understand, go through these things like this. And there is another
Okay,
one.
sir.
Passive voice, active voice, how to do. Okay. So you have to go and see all these things. Then passive voice for referral OET letters. What is passive voice? How it is? All these things you can go and learn. Now share your experience. How did you feel regarding this particular session? Was it beneficial for you? Who recommended you? Why you came to me? With what confidence you came to me? Tell everything about your from the beginning to now, how you were recommended by some other doctor who passed.
Yeah. I came to Mr. Simon, and I was referred by my one of my colleague named Dr. Satyakumar, who is an orthopedician. He took the exam, I think, around I think 6 months back. He passed the exam in second attempt. And I too failed in IELTS before twice, and I thought I should move on to OET, and he recommended me Mr. Simon. And with his confidence levels, and I believe in him, so I moved on to Mr. Simon, and he is helping me a lot in improving my English proficiency. And I look forward to do more sessions and spend more time learning English from him. Thank you.
Right. Okay. Right. That's the end of the session. So,